I appreciate the fact that you saved the best for last.
Absolutely.
I had really hoped that when we came here that we were really going to push over the top. We are so close to national health insurance. We are so close to allowing people that go to work every day and don't know what could happen to them, whether they lose their job and lose their health insurance. I know that they call the Senate the upper house, but I was amazed how it seems as though they believe the American people only listen to those from Wyoming and Kentucky. But having said that, for my New Yorkers, even though we have more self-confidence that we need, I would want them to know that they are Americans and we do listen to them, and that the states that oppose this great plan doesn't speak for all of America. Having said that, some people have called those who oppose us as being the party of no. I don't think so, notwithstanding the fact we got 5 Republicans from the Ways and Means Committee here at your summit. Now, when we spent hundreds of hours in 3 committees and Ways and Means, and there wasn't one bill before us. And I would think that instead of taking the president's time, that this is where the House and the Senate would take care of legislative business, especially if we agree on 70%. For God's sake, then for the 10 or 20%, why do you say scrap what we got unless it ends up with that you have made up your mind that we're not going to have a health bill? And then I would say that most all of America would find it not more difficult to understand why the bill is so big or why we use reconciliation. I think one of the big problems America would have is, why does it take 60 to get a majority? And I have to explain, well, that's the Senate, and they're different than most Americans in understanding it. So what I would hope would happen is that we leave here not thinking that we're going to start all over. We can't get back those times. This is the last year for a whole lot of people in the House of Representatives who we believe we represent the people too. Why can't we take what we've agreed to? I mean, sick people, scared people are not Republican and Democrats, they're Americans. And you've made it abundantly clear that you have the same sensitivity, you recognize the fiscal crisis, you know what can happen to our country if we're not educated, if we're not strong in a healthy way. Have staff or somebody bring together those issues that cannot be contradicted in terms of what you want. And I know you want more than just 3 million people insured. You can explain why it's difficult for you to do it. But I know you would want to achieve having most all Americans, or all Americans, with the same health benefits, because that's so important. And then, Mr. President, after we start learning to agree with each other, and it's not a question of no, but it's the Congress working its will for the good of people, then we can work out, and God knows Mr. Kemp and I have tried desperately hard, and Jim McCreary before him, to realize people aren't concerned with the debate. They're concerned with what are we going to produce. And I don't care what your color is, I don't care what your party is, that if you're sick, and you don't check out the doctor. And they're not going to check out whether or not you're Republican or Democrat. So I just hope that we can change this to a positive thing where you can say, let's leave here at least talking about what we agree on. Let's stop knocking each other as who's the smartest and who's the most patriotic. And let's really then confine the public argument to where we disagree. And rest assured, I can assure you that they won't be concerned with how big the bill was. I have no clue as to how big the Social Security bill was, how large, how many pages was in the Medicare bill. And I don't really think that someone sick in the emergency room is concerned about the size of the bill that we are trying to help them with. So I appreciate this. And
John Dingell.
Mr. President, thank you. And God bless you for your leadership in this matter. The country desperately needs you and desperately needs this legislation. I saw that cartoon. Two people are sitting down, and one of them says, "Terrible news. Our health care rates are going to go up 40%. The other guy says, "Don't worry. Good news is you're not concerned because you have pre-existing conditions." This solves both problems, the bill. And Mr. President, again, we desperately need your lead. Now, having said that, when my dad started out on this years ago, Harry Truman said, "You know the reason people don't have health care in this country? They can't afford it." And he was right. And it's still the case today. I saw this morning a statement that was made with regard to starting over. This comes from a respected Republican leader, Governor Schwarzenegger, California, February 23rd, 2010. "I think any Republican that says you should start from scratch, I think that's bogus talk and that's partisan talk." I think we need to buckle down and get to the business of solving the biggest problem that this country has coming down the road at us. In 2025, the cost of a family's health insurance is going to double, $25,000. I don't know anybody can afford that. You can argue about Cadillac plans and other nonsense. That's not going to be important. And in 2080, the cost of all of our health care is going to equal the gross domestic product. It's a recipe for disaster. We have much in common, I want you to know, and I hope and pray you'll take a look. We cover young adults under their parents' insurance. That's a Republican offer. We prohibit dropping insurance coverage when the patient gets sick, but we don't. And the Republicans do too, but they don't cover pre-existing conditions. Both of us prohibit annual and lifetime limits. High-risk pools we have and they have. But high-risk pools carry with them some risk because it constitutes an incentive for a race to the bottom, whereby people will move their insurance companies to a place where they have the least regulation and the least protection for the consumers. And it also includes, and amongst the other 14 items where we're agreed on, is the availability of health savings accounts. There are a lot of other things here that we have and we need. I would say that I've seen some of my friends who I knew before they were virgins. They were pushing, for example, use of the extraordinary budgetary mechanism, and as to get this decided by 51 votes. Seems like a great idea. And I'm curious, why in the name of common sense are we being so fussy about having the decisions in the people's House and the people's Senate decided on a basis of a simple majority, 51 votes? And if there's something wrong with that, I wish somebody would tell me why we ought not give the people that kind of representation. I would note that also mandatory coverage mandates. That was in a bill introduced by my good friend Bill Thomas, Chairman of Ways and Means Committee, and 20 members of the U.S. Senate. They said, and they were not fussy about that. And I think we ought to look to see, here we have a chance to serve the people. I have people coming to my office with tears in their eyes. They can't get coverage. They have pre-existing conditions. A young dental surgeon I knew couldn't get health care. Why? Because she'd had breast cancer years before. She couldn't get care. And I've seen a lot of other cases like that. People who would have drive-through pregnancies or drive-through mastectomies and all manner of high-handed abuse by the insurance companies. I'm always surprised when I can find somebody that's defending the insurance companies after the things that they do to the ordinary people in this country. They could cancel your insurance policy while you're on the gurney headed into the operating room. If somebody would explain that to me, I would be deeply grateful. But the fact of the matter is, we have a chance to do something that Dan Webster one time observed. I thought it was a very useful thing that he said. And I think we ought to say, he said, let us see whether we also in our day and generation may not perform something worthy to be remembered. It's on, Madam Speaker, as you well know, it's on the wall of the House of Representatives. It's there for us in the House, and my colleagues in the Senate will know it. Those of you who I see again and observe with us will recognize that as something. We have before us a hideous challenge. The last perfect legislation that was presented to mankind was delivered to the Israelis at the base of Mount Sinai. It was on stone tablets written in the fingers of God. Nothing like that has been presented to mankind since. What we're going to do is not perfect, but it's sure going to make it better, and it's going to ease a huge amount of pain and suffering at a cost which we can afford, which has been costed out by the Office of Management and Budget and the Congressional Budget Office, saying it's budget neutral. It in fact reduces the budget. I beg you, my friends, let us go forward on this great task.
Thank you, John.
Thank you, Mr. President.
Speaker Pelosi wants to say a brief word. John, do you want to say anything in closing? And then I will wrap up. Nancy.
Thank you very much, Mr. President. As one who has abided by the 3.5 minutes, I'm going to take a few seconds more now in closing to extend thanks to Mr. President for bringing us together, for your great leadership, and without it, we would not be so very close to affordability, accountability for the insurance companies, and accessibility for so many more Americans to improve their health care, to lower their cost. Mr. President, I hearken back to that meeting a year ago. At that time, Senator Grassley questioned you about the public option, and you said the public option is one way to keep the insurance companies honest and to increase competition. If you have a better way, put it on the table. Well, I bring that up because we have come such a long way. We're talking about how close we are on this, how far apart we are here. But as a representative of the House of Representatives, I want you to know that we were there that day in support of a public option which would save $120 billion, keep the insurance companies honest, and increase competition. We've come a long way to agreeing to a Republican idea, the exchanges. Senator Enzi has been a leader in that. Senator Snowe, along with Senator Durbin, had legislation to that effect, a bipartisan, because the insurance companies opposed the public option. They couldn't take the competition. We have in our bill market-oriented, encouraging to the private sector initiatives, has behaved shamefully, and we must act on behalf of the American people. We have lived on their playing field all this time. It's time for the insurance companies to exist on the playing field of the American people. I believe I have news for some of my colleagues, because we have very much more in common. Senator Coburn, you had so many positive suggestions, which I didn't hear much else of, but from you we did. And I think you'd be pleased to know that after much debate in our House, we came up with value, not volume. Others have called it quality, not quantity, in terms of utilization, overutilization. Senator McCain, when you talk about Florida, we're talking about addressing the regional disparities in terms of compensation and health care. So we have addressed many of these issues in the bill. I think it's really important to note, though, and I want the record to show, because two statements were made here that are not factual in relationship to these bills. My colleague, Mr. Leader Boehner, the law of the land is there is no public funding of abortion, and there is no public funding of abortion in these bills, and I don't want our listeners or viewers to get the wrong impression from what you said. Mr. Camp, you said that the Medicare cuts in this bill cut benefits for seniors. They do not. They do not. So I want the record to show, just in those two cases where we may have differences of opinion and of approach and evaluation of the value of different things, but certain things are facts about our bills that I cannot let the opposite view stand when they are stated. Yes, it's hard to do this. Misrepresentation campaign that is going on about these bills, it's a wonder anybody would support them, as Mr. Waxman said. But the fact is, as the President said, many of these provisions on their own are largely supported by the American people. So this will take courage to do. Social Security was hard. Medicare was hard. Health care reform for all Americans, insurance reform is hard, but we will get it done. And as we leave this debate, I think that many of the differences that we have are complicated, and they're legitimate. They're differences of opinion about the role of government and the rest. But I think it's really clear on one point that the American people understand very clearly. They understand that there should be an end to discrimination on the basis of pre-existing conditions. The proposals that we have put forth end discrimination on the basis of pre-existing conditions.